Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. In today's video, we're going to be discussing a medication known as Nabumetone. Its brand name is Relafen. And before I talk about the medication itself, just keep in mind that this channel is for information purposes only, and not to be used as a source for recommendations for your personal health care. Now, during this presentation, we'll discuss the mechanism of action or how this medication works, indications or reasons we would prescribe this medication to a patient, followed by contraindications or reasons we would not be able to prescribe Nabumetone. We'll then touch on an example of dosing, and then finish it off with side effects with percentages. I've put together some slides to go over this information, so let's jump right into it. So the first thing to discuss here would be the mechanism of action, or how this medication works. So Nabumetone is a prodrug that is biotransformed into 6-MNA and is a non-steroidal anti-inflammatory drug. It also has anti-pain and anti-fever activity. The anti-inflammatory property may be attributed to its ability to inhibit prostaglandin synthesis. In terms of indications or reasons we would prescribe this medication to a patient, we may see it used in the treatment of osteoarthritis, as well as in the treatment of rheumatoid arthritis. With respect to contraindications or reasons we would not be able to prescribe Nabumetone, well, we wouldn't give this medication to a patient who had a hypersensitivity to Nabumetone or to any other component of the formulation. If a patient had asthma, urticaria, or an allergic type reaction following aspirin or other NSAIDs in the past, they would also not use this medication. Finally, this medication would not be used in the setting of a CABG or coronary artery bypass graft surgery. Now for an example of dosing with Nabumetone. So in the treatment of osteoarthritis and rheumatoid arthritis, the dosing would be the same. The initial dose would be 1,000 milligrams orally once a day, and the maintenance dose would be 1,000 to 2,000 milligrams per day, given orally, divided 1 to 2 times. As with all medications, there are some side effects or adverse reactions that patients may experience while using Nabumetone. We'll go over some of those here now. Some common side effects may be edema, happening 3 to 9% of the time, pruritus or itchiness of the skin, again coming in at 3 to 9%, a rash, which may happen up to 9% of the time, or abdominal pain, which may happen 12% of the time. 3 to 9% of patients may experience constipation, and 14% may experience diarrhea. Indigestion seems to happen 13% of the time, and nausea 3 to 9%. Up to 15% may have an increase in their liver function tests, and up to 9% may have dizziness. Feeling of nervousness comes in between 1 and 3% of the time, and a headache at 3 to 9%. Insomnia may happen between 1 and 3% of the time, and 1 to 3% of patients may experience somnolence. Now, some more serious side effects would be hypertension or high blood pressure, bronchospasm, or angioedema. Alright everybody, that's all we're going to talk about today with Nabumetone, or Relafen. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, remember you can like the videos, share the videos, most importantly subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.